Welcome to Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, the topic we're going to be discussing is a topic that quite often comes up, but it may not be the first or second concern or question that a family has when they're caring for a loved one with dementia, but it's an important topic nonetheless, and that's oral care for loved ones with dementia. There are many challenges families face when they're caring for a loved one with dementia, and taking into account their behaviors can change day to day can make it especially difficult if you're also faced with being able to get them to brush their teeth. If you've already tried getting your loved one to brush their teeth, or you've already had this challenge, then you know just how difficult it can be. Maybe they're unable to brush their teeth themselves and they need your help. There aren't too many people who will allow someone to just stick something into their mouths while they're just sitting there or standing there. This isn't because they're intentionally trying to be difficult, it's just human nature. Now, when you take into consideration that they also have dementia, it becomes even more of a challenge. Remember, they will need your help and your patience. Good oral hygiene is important, and without it, it could lead to more complications and unwanted issues. So we're going to be going through some tips to help make sure that your loved one is getting the proper oral care that they need. These first few tips are geared more towards if your loved one is still physically actively brushing their teeth or caring for their dentures on their own, albeit maybe with some assistance and reminders by you. But overall, you're not having to physically brush them, and although it's still challenging, they're able, with some assistance and reminders and guidance, to do it themselves. So one of the first things you will want to do if you're not sure if they are practicing good oral care is to check their toothbrush after they've gotten ready. And if they are adamant that there's nothing to worry about, then their toothbrush initially would be a good indicator, and also their toothpaste. Have they had the same toothpaste forever, it seems like? Or did you check their toothbrush after they've insisted that they brushed their teeth? If the brush is dry and the toothpaste has been there longer than you can remember, then there's a pretty good chance they aren't brushing their teeth, at least regularly. Next, so you can let them know you have set up their toothbrush for them. Leave their toothbrush on the sink and put some toothpaste on it for them. Then gently suggest or coax them to the bathroom and make some small talk as you wait for them to brush their teeth. And also, there's no rule that teeth have to be brushed in the bathroom. If they're opposed to joining you in the bathroom, try the kitchen area and leave their toothbrush. And remember, also have the toothpaste on their brush for them. And maybe a change of scenery will do the trick. But if your loved one is wearing dentures, have a cup ready for them with their cleaning solution and blame their doctor if they get upset. After all, it's doctor's orders that they take good care of their dentures. Dentures are expensive, and they seem to come up missing quite often. Unlike the toothbrush, it's a good idea to have their denture cup and cleaning solution in the same spot every time. Now, if your loved one's dementia is more advanced, the American Dental Association has provided some suggestions to make it easier on families and caregivers of loved ones with dementia to practice good oral care. As we've discussed in other episodes, nonverbal cues are especially important for loved ones with dementia. For loved ones with more advanced dementia and memory loss, make sure that you go slow and to keep your requests to one at a time. Don't overwhelm them. Giving multiple steps or requests to quickly perform can be overwhelming for someone with dementia, and they can shut down and become confused with multiple instructions being given to them all at one time. For example, it's recommended, instead of saying, "You need to go brush your teeth," make it a step-by-step process instead, and remember, go slowly and speak clearly for them. You can start off by saying, "Let's go to the bathroom," followed by, "Let's get your toothbrush." Then after they've done that, "Now we need to put toothpaste on your toothbrush." Then, "Let's brush your teeth," and finally, "Rinse your mouth out." This method takes that original statement that we said not to say from "you need to get your teeth brushed" to a slowed down step-by-step process where you wait for the first step to be completed before going on to the next one, and so forth. However, maybe your loved one is unable to physically brush their teeth themselves and you need to do it for them. Here are some recommendations to help. First, you should never force them to open their mouth and never try prying their mouth open. If you try and they refuse, take a break and come back and try later. Most of us have probably all, at some point or another, had a toothbrush that we needed to get rid of and replace it with a new one. Well, it's no different for people with dementia. If they feel like the toothbrush is too hard on their gums or they feel uncomfortable, remember those nonverbal cues we've talked about. You'll want to either try a soft toothbrush, or you can even use a Q-tip and put a small amount of toothpaste on it. Or you can even take some gauze, wrap the gauze around your finger, and slowly try brushing their teeth that way. If you need to do the brushing for them, it may be easier for you to have them sit on a chair, somewhere where they're comfortable, and brush from behind. Or if they prefer to stand to let you do it, or they want to try helping, make sure that you stand on their dominant side. If they are right-handed, stand on their right side, and vice versa. Another note we should mention, if you have concerns that your loved one may swallow the toothpaste rather than spit it out, you may want to consider using baking soda toothpaste or just water. And the same holds true for anti-plaque rinse. Yes, this is helpful in preventing gum disease and can be used to help substitute brushing if you're not able to get their teeth brushed, but if there's a chance you think they may swallow it, don't use it until you consult with their doctor or dentist about the concerns you have of them swallowing it. If your loved one has a dentist that they are established with, contact them and see if they are experienced with patients who have dementia. Or maybe they have suggestions or know of methods or products that can help in their oral care. And if they aren't experienced or comfortable with a dementia patient, speak to them about referring your loved one to a dentist that specializes or has experience working with patients who have dementia. Oral care is an important aspect of personal care and hygiene and health, and people with dementia can have more difficulties than others maintaining that hygiene and that care. We want to take some time and say thank you for being here with us today. We here at All Home Care Matters are here for you and to help families as they navigate long-term care issues. We invite you to please visit us at allhomecarematters.com, where there is a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. If you know someone who could benefit from this episode, please share it with them. And we hope you'll join us next time here at All Home Care Matters, where we're going to be discussing care plans and what they are. Thank you so much.
Thank you for joining us today. We look forward to you joining us again on another episode of Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.